Like the saddest thing I think about COVID has been that it's been a lonely disease. So usually the nurse or the doctors that are involved trying to be there to not let the patient die alone, so to hold their hand. We've often video called the families. Where I work, there's an iPad, so we're able to contact the families so that they can see their loved ones. And in many hospitals, the groups of nurses in that area will stand around the patient so that the patient doesn't die alone. Recently, I lost a fantastic nurse, and I had to speak at her virtual funeral a week ago, which was exceptionally sad. And then another colleague lost a wonderful nurse from a hospital down the road. And all the nurses there actually stood on guard with their PPE as that nurse left the ICU. We're trying to be there instead of the families. Obviously, it's not the same, and we're trying to video call. It's very hard. It's a very lonely death. A lot of nurses have actually been infected, a lot from the community actually. And fortunately, most of them have recovered, both in Gauteng and in the Cape, because they've also had a huge increase in terms of nurses infected. So most are coming back to work. But there have been one or two, luckily it's not a big number, who have passed from COVID. And everybody seems to know one, which is quite hard.
So they're not actually picking it up in the hospitals themselves, but in the community?
Yes, actually. So most people are actually picking it up in the community. When I had a discussion with the Cape Town group, and also just with our microbiologists looking at our statistics, the majority are picked up in the community. Very, very few are actually picked up in hospital. There was a time where before there were still meetings in tea rooms and things like that, where there was one or two hospital transmissions. But mostly because of PPE, we're not really picking it up from the patients. And even with the doctors that I know close to me, 1 out of the 7 have been infected from work, but not actually from the patients.
This is an excerpt from Biznews Radio. Get the full interview by downloading our free app. Search Biznews Podcasts on the Android or Apple App Store.